pelvic
Is this ruining
stabilization. So let's have a look here at your ASISs. Hers are pretty easy to palpate.
Yeah.
So right ASIS is low. Are you there, Krista?
Yeah.
Yeah.
And let's
Yes.
see the PSIS. Now, with this hat rolled up here, don't let that deceive you. It's not sitting exactly even. But you see right low.
Right slow.
No, just a second. This is throwing me off. Okay. So right is high,
Yeah.
and we saw right low in the front, correct?
Yes. Yes.
Okay, so this has gone into flexion on her right side. So let's have you lay on the table. And we have gone in already and worked the ligaments on the sacrum and the muscles between the sacrum and the iliums. And yesterday, someone worked on your iliacus and psoas, is that right? Or do you think they're still?
I don't know. I don't
Let's
remember.
just check that.
What do you want?
I do want that up, yes.
Okay, well it is, yes, now.
So the iliacus originates on the inside of the hip bone. I tell my clients, you think of your pelvic bone as like a seashell, and the muscle fibers are inside that seashell, and they go down to your leg. And then I'll go over to the psoas. Psoas originates. I have to kind of sneak over here. The rectus abdominis wouldn't let me in where I was first there. I'll kind of circle my way in, go right over to her spine. Is that pretty tender? Not too bad.
It's not as bad as the iliacus was.
And this runs down to her leg as well. And then we'll go to the insertion of the psoas in the iliacus. It's right
God.
there. And the lesser trochanter.
The lesser trochanter should be laterally, right?
The greater trochanter is lateral and the lesser trochanter. The greater trochanter is lateral and the lesser trochanter is medial, I believe.
Yes.
And there's a little window in between the muscles here where you can sneak in. I don't think I showed you that yesterday, did I? So the psoas comes to this spot and the iliacus comes to this spot. They all attach. They have a common tendon. Sometimes. What's that? Lesser trochanter is correct, yes. I thought so. And sometimes this muscle is considered one muscle and it's called iliopsoas, but really it's better to think of it as two muscles with a common tendon. So we work those insertions and origins and the muscle, and now we'll bring your feet up. And probably you'll have to be on the other side of me to see this one. I'm going to get on the table here and kind of mobilize things here. Your job is just, if possible, just to stay as relaxed as possible. There you go. And now I'm going to put my knees under there. She's pretty mobile, so they're not quite as far. Now I'm going to put my hands on your iliums here and push in, and your job is to put your hands on my elbows and push straight in as well. And by doing this, we'll help to open up the SI joints in the back, hopefully. Okay, that worked really nicely. I could feel them moving a little bit. Were you able to feel it?
Yeah, I could definitely feel it.
So you felt it gap at the back, and you felt the front moving, or just say what you did feel.
I felt like my pubic bone was like doing what it needed to do.
Interesting. Then I will have her bring your knees apart and put my arm in between. And okay, now squeeze together. Okay, and relax. You feel any movement there?
Yeah, it feels like something's gonna.
So it felt like it needed to, but it didn't go? Is that what I'm hearing you say?
Like it would be close to, yeah.
Yeah, okay, well then that keeps it here. And press your knees apart for me and just keep pressing, breathe normally. Okay, take a deep breath in, and you let the breath out, let the muscles relax. Okay. Next time, just let them go exactly the same time. Okay, let your knees go apart further still. A little bit further.
I can go far, so I don't know how far you want
Yeah.
me to go.
Okay, now press out again. And it's so much easier. You let the tool hold. You know, one time I tried to use my arms to hold, and legs muscles can be very strong. Okay, deep breath in. Muscles at the same time as the breath. That's it, perfect. And now squeeze again. There. Did you feel right here? I heard it actually
Yeah.
pop a little bit. Yeah. So it wasn't way off, but it did correct a little bit. And which is probably what it needed. And that leg down. And this arm away. And I'll bring this up just on my shoulder. And I'm going to get a hold of her Iliopsoas in here. And bring it up. Your job is just let your back stay relaxed. This can be. You push with your hamstring against me. So push me away like towards the ceiling. Okay, relax.
I for sure feel that in my psoas on this side.
And we'll go over to the other side and then come back and do it twice on the other side. Just bring this hand up out of the way. Now this side, the rectus femoris is a little tighter. We see her leg coming up. Okay. Actually, I don't need to have you push this side. So we know that her rectus femoris was tighter on the right side, which was maybe causing a lot of deflection, and we didn't work it quite enough. Can you press against me? Her hamstrings are so limber that I need her to push. You're pushing me towards the ceiling, not so much your calf into me. That's it, that's it. So she's pulling her, because I'm not letting her leg move, she's pulling her ilium toward her ischial tuberosity towards the ceiling. Okay, relax.
It's like I don't know how far I can hold that.
Yeah. So I was trying to talk to them.
Okay, so if they're flexible, you add like the PNF.
You would have them engage the hamstrings.
Right. So this afternoon, whoever works on her needs to really work that rectus femoris. Because do you remember when I did this side, this leg just stayed right down. When I did this side, this one came, the whole leg came up a little bit. So that tells us that rectus femoris is still a little bit tight. Because it was a whole leg, it wasn't the psoas. And oh yes, bring your knees up for me. Lift your pelvis on the table, set it down, legs back down. And let's see how it is. And laying down, it looks like that's perfect. And let's have you stand up and see what it looks like.
You want to show her how to do that.
Christy, you come to this side now.
Those exercises.
Clock face, train on the
We'll
track.
do that all as a class. Looks perfect to me. Yeah. So that's gone. Now, if you let somebody work this area and this and keep that softened up, that flexion should be hopefully gone permanently.
Okay, good.
That looks good.
I'm really, really trying to be precise.